Hi, everybody. My name is Dr. Roney. I'm the clinic director for the Cancer Center for Healing. I want to take this opportunity to welcome you to the center. And the purpose of the video is to give you kind of a step-by-step process of what to expect today and over the next few days to weeks while you're here. I think it's important personally to make sure that your anxiety or fear or apprehension is met with information. And I believe the more information that you have about the process, I think the more you can relax, right? And the whole goal of you being here is to heal. So I think a video like this is really important as to what to expect over the next 24, 48 hours and beyond. So let me give you that understanding. So the first thing you will do is you will meet with the doctor for your consult and your exam. And the doctor's obviously going to have reviewed all of the lab testing and diagnostic studies that you send in, your medical records, if you will. And then when you get in to the exam room, they're going to do a full exam and make sure that they understand things as much as possible, of course, ask you as many detailed questions, give you an opportunity to ask questions as well. And then as a result of all that, they're going to put together a plan. And this plan is going to be kind of an interim plan or an initial plan, because they're most likely going to recommend more labs to be done, right? We do labs on circulating tumor cell activity. We'll use companies like the RGCC test from Greece, or Guardant 360 or Fulgent. There's a number of different high-tech, if you will, labs that we'll do. And then also some of your standards if they're missing, and things like nagalase and PHI and D-dimer, which we'll explain why we do those as well. But ultimately, you're going to have a good, robust amount of labs to do that's going to give the doctor a little bit more insight on steps to take, that are going to be more comprehensive and specific to you. And that's one of our goals here. And then the doctor is going to write orders for you, or the plan. And that plan will be reviewed by the doctor in the consult. And then I'll be in there as well to make sure that I can dot I's and cross T's and almost quarterback this thing for you. So you'll have me as a resource at the end of the consultation to make sure you have questions answered. I can dot those I's and cross those T's for you. So the objective, again, is for you to leave that consult where you're going, I understand step one, I understand step two, I understand the future steps, etc. So that's going to be our job in that consult, along with the data collection and developing a plan for you. Upon completion of the exam and that process, I will help you and guide you to your advocate. So here we have patient advocates, and their job is to then take you from the doctor and myself and process the orders, meaning there's going to be labs that you're going to need help with. They're going to help you with that. Their job is to help you if there's any supplements that are initially recommended. They're going to help you with that. They're going to help you with your scheduling of the treatments and the modalities that were given via the doctor in the plan. So, and then you have check-in and check-out that's going to be able to help you with scheduling and going to be able to help answer questions. We have a health coach and an assistant advocate named Kumi who's going to be involved. We have the call center that you could call anytime to schedule. And then when you're here day to day, you're going to have myself, the advocates, Kumi, and then your nurses are going to be on the floor constantly. And we have a full schedule of nurses, and they were going to be there each and every step of the way to help answer questions and guide you and administer IVs and so forth. And then we'll be able to schedule you for follow-ups as well. So the advocates are going to help you with that. So basically, you're going to come in and get an initial plan. And then as the labs come back, we're going to refine the plan more and more based on the data that's received. But initially, you're going to have a plan that is going to follow our basic four-pillar approach. What are we going to do to oxygenate the body, to alkalize the body? Because the cancer cells don't thrive in an oxygenated and alkalized environment. They thrive in more of a low oxygen acidic environment. So right away, we want to change the terrain there. We want to do things that are going to boost your immune system. So things like vitamin C IVs or mistletoe might be a very good way to do that. And that's going to be helpful for almost anybody because number one, it's going to be immune boosting, but it can also be cancer killing. So we want to implement some of these strategies initially, and there may be more, ladies and gentlemen, but I just want to give you an idea of some of the basics that will be done. Oxygenation, alkalization, immune boosting, and then some testing might be recommended for causes, right? Pillar 4 of our 4-pillar approach are the causes. What, if any, different things have caused this cancer to thrive, right? So we want to make sure we're starting that process as well. So again, that just gives you an idea of what to expect today and subsequent days, and you will have resources to help you through that process step by step. If at any time you have direct questions, you can come right to my office. We'll show you where that is, and I can help you be a liaison, if you will, and guide you through that process. So just wanted to let you know that's what to expect today and moving forward through the plan. And then our job is just to guide you through that plan step by step and make you feel almost at home and very comfortable. So your job is just to heal. Okay? So welcome. And if you have any questions, you can let me know. I'll directly help you as much as I can.